Your recovery after oral surgery is improved by following instructions for post-operative care. We would like you and your at-home caregiver to know proper methods of taking care of the areas of surgery to promote optimum healing. You will be given written instructions to supplement this video. Please read them thoroughly and keep them handy for reference during the next few days. If there is ever a question about how to care for yourself, or if healing is not proceeding according to your expectations, please call the phone numbers listed on the written instructions. Immediately following surgery, patients may feel slightly dizzy or lightheaded. They should have a responsible adult help them leave the office, assist in walking down any stairs, and drive them home. Patients should also plan to relax for the first 24 to 48 hours following surgery.
Intermittent oozing or light bleeding is normal for up to several hours, and you'll be given extra gauze for at-home use. Now, when gauze packs become saturated, go ahead and remove them. Take a fresh piece of gauze, fluff it lightly, and place it gently over the surgical site. Gauze may be moistened and squeezed damp dry before fluffing to make it more comfortable in the mouth. Be sure there is enough gauze to exert moderate pressure on the surgery area, and be certain that it is directly on the site, not merely clenched between upper and lower teeth. Leaving the packs in place for longer periods is better than changing them every few minutes. Try to leave packs undisturbed for 30 to 60 minutes. Now, if you run short of gauze, additional sterile gauze may be purchased at any drugstore or most supermarkets. The bleeding should not be severe or uncontrolled. If it is, we usually find that the gauze pack was not placed correctly on the surgical site. Check to be sure the pack is correctly positioned. If bleeding persists or becomes heavy, you may substitute a tea bag that has been soaked briefly in hot water, squeezed damp dry, and wrapped in a moist gauze. If you are unable to control bleeding after 1 or 2 hours, please call our office for advice. It's very important for a blood clot to form in the surgical site. Therefore, do not disturb the surgical area for the first day. Do not rinse vigorously, use a straw, brush in the immediate surgery area, or probe the area with fingers, toothpicks, and the like. Do not smoke or use tobacco for at least 48 hours, since tobacco in any form is very detrimental to healing. There is often some swelling with oral surgery, particularly when wisdom teeth are removed. And the swelling may be minimized by applying cold compresses firmly to face or cheek adjacent to the surgery areas. These should be applied 20 minutes on and 20 minutes off during the first 12 to 24 hours after surgery. If you've been prescribed medicine to control swelling, take it as directed. After the first day, it's usually best to switch from cold to moist heat in the same areas.
Unfortunately, most oral surgery is accompanied by some degree of discomfort. In most cases, you'll be given a prescription for pain control medication. If you are not given a prescription, ordinary over-the-counter remedies such as aspirin, acetaminophen, Tylenol, or stronger medications like ibuprofen will usually suffice. Pain is best managed by taking the first pill well before the numb feeling from the local anesthetic has worn off. Effects of pain medications vary widely among individuals. If you do not achieve adequate relief, you may supplement each pain pill with an over-the-counter analgesic, such as acetaminophen. Some patients may even require 2 of the pain pills at once during early stages after the anesthetic is worn off. But it is not recommended because they may add to the risk of an upset stomach from overdosing with stronger pain medications. Remember that the most severe discomfort is usually within the first 6 hours after the anesthetic wears off. After that, your need for medication should lessen.
Nausea is sometimes an after effect of surgery, brought about by stronger pain medicines. Nausea may be reduced by preceding each pain pill with a small amount of soft food, such as Jell-O, pudding, or cream soup. Then take a pain pill with a generous amount of water. Sips of carbonated drinks, such as cola or 7-Up, that have been stirred to reduce carbonation may help with nausea. Try to reduce the amount and frequency of pain medication as time passes. and if nausea persists or is a problem, please call the office for advice. You don't need to stop eating, and it's important not to skip meals. If you take nourishment regularly throughout the day, you will feel better, recover more quickly, and have less discomfort. Remember to drink 8 to 10 glasses of water per day to help your recovery. It's important to remove any gauze packs before attempting food intake. It's recommended that the first day's intake be confined to bland liquids or very soft foods, cream soups, puddings, yogurt, milkshakes, etc. It's important to avoid vigorous sucking maneuvers, so don't use a straw. It could break up the blood clot and cause a dry socket complication, which would require several further visits to your surgeon for treatment. Temperature of food isn't critical, except that very hot food should be avoided for 24 to 48 hours. Over the next several days, you may progress to solid foods at your own pace. Avoid foods like nuts, sunflower seeds, popcorn, and breads with seeded crusts for a week or two. They may get lodged in socket areas. If you're a diabetic, maintain your normal eating habits as much as possible. Major changes in carbohydrate intake may change your insulin requirements, so faithfully follow your physician's instructions to monitor blood sugar and maintain your insulin dosage.
Instructions change somewhat after the first postoperative day. By then, the stormiest part of recovery is usually over, and you should note improvement after 24 hours. Keeping your mouth clean is essential. Dissolve 1/4 teaspoon of salt in an 8-ounce glass of warm water. Gently rinse with portions of the solution, taking 5 minutes to use the entire glassful. The warm salt solution will help soothe and cleanse the surgical areas. Repeat as often as you like, but at least 3 to 4 times a day for the next 5 days. Try to return to your normal oral hygiene routine as soon as comfort allows. Soreness and swelling may not permit vigorous brushing of all areas, but please make every effort to clean your teeth and mouth within the bounds of comfort. Keep up warm saltwater rinses.
Apply warm compresses to the skin in areas of swelling. Hot water bottle, moist hot towels, or heating pad for 20 minutes on and 20 minutes off to help soothe those tender areas. This will also help decrease swelling and stiffness and promote healing. Some patients may be given a plastic, curved-tipped irrigation syringe on the first or second postoperative appointment. Do not start using it until about 1 week after surgery. Fill it with warm salt water, and especially after eating, gently irrigate any sockets that remain open and seem to trap food particles. This will keep them clean and help them close more quickly. The normal course of healing after tooth extraction or ordinary mouth surgery should be as follows. 1. The first day of surgery is usually the most uncomfortable, and swelling and stiffness increases. Number 2. The second day is more comfortable, but is often marked by continued soreness. Usually improvement begins, although there still may be swelling. You are usually able to reduce pain medication and increase food intake. 3. From the third day on, gradual but measurable improvement should be the rule. Increased diet and application of warm packs should definitely reduce the need for pain medication. 4. You may notice a slight temperature increase, which can be due to dehydration, so continue to drink 8 to 10 glasses of fluids every day. 5. As healing progresses, you may feel sharp edges in the surgical areas. These are probably the edges of bone along the sockets that supported the teeth that were removed. Occasionally, small slivers of bone may work out during the weeks following surgery. They are not pieces of tooth. We will monitor your healing, and if necessary, may remove any sharp edges that are bothersome. In some cases, your surgeon may place sutures over the surgical site to hold the area closed. Some sutures dissolve over a period of time. If your sutures are not dissolvable, your surgeon will schedule an appointment to remove them.
There is one common complication of extractions, especially with lower wisdom teeth, which should be monitored. It is called dry socket and is caused when mouth bacteria invade the protective blood clot, causing its breakdown and loss. It usually starts on the 3rd to 5th day after there has been measurable improvement. It presents as a distinct, persistent throbbing pain in the jaw, often radiating toward the ear and forward along the jawline to cause other teeth to ache. If you feel this might be the case, please don't suffer needlessly. Call the office as soon as symptoms arise so this condition can be treated early. Local treatment can be given to alleviate the pain, but healing will be delayed for several days until nature can regenerate a protective covering for the affected tooth socket. You should also see your surgeon if you notice excessive swelling, persistent pain, excessive muscle stiffness, redness, have difficulty swallowing or opening your mouth, or have a fever and chills. Oral surgery, like any surgery, has risks that can occur despite the best of care. You may remember discussing these risks before surgery. One risk we discussed was the possibility of a change in sensation of the lip, chin, gums, teeth, or tongue. This change in sensation requires close follow-up care. It is very important for you to keep all of your follow-up appointments so that we can evaluate your progress and develop the best treatment plan for you. It is our desire that your recovery be as smooth and pleasant as possible. Following these instructions will help greatly, but if you have questions about your progress, please call the office number shown on your printed post-operative instructions. Please try to call during office hours for fastest response.